Before we start, welcome. This is a session on options, housing options, I'm going to call it for short. My name is Gitty Neufeld. I'm going to be the moderator, and I'll be introducing our wonderful speakers in a couple of minutes. I will ask you, I know people, if you're in this room, you cannot be incommunicado, so just put your phone to vibrate, please, so that it doesn't disrupt other people. So, what's this session about? Okay, as I said, my name is Gitty Neufeld, and I'm just a kid. I had parents, thank God I still have a mother, I had in-laws. And my mother-in-law, at the age of 90, was still living alone, except I was going to Manhattan 3 days a week to do her shopping, her laundry, take her to doctors, but she was fiercely independent and lived at home alone. And it worked. It made my family crazy, but it worked for her. She then fell and broke her hip and was wheelchair bound for outside. In the house she could walk with a walker. Outside she needed to use a wheelchair. So we built an apartment, added it onto our house, and she came to live with us, and she lived with us until she passed away. That's one model. When you have somebody who is competent mentally, a week before she passed away, she actually wrote out a check for perpetual care for her parents' graves, because she said, it's before Rosh Hashanah, I want to do this, and she took care of that. And it was difficult. She was physically handicapped. I needed to bathe her. I needed to dress her. But it was easier because she followed directions, because she understood what was going on. I always say the fact that my grandchildren knew their great-grandmother lived around the corner is something that could never be replicated. Now let's move to my dad. My father passed away 3 years ago. He had dementia. Dementia for 18 years. I think he's pretty close to a world record on that. And for the first 16 years, my mom, God bless her, took care of my father at home by herself. Refused to have any aides, refused to have anybody help her. We would take turns coming for Shabbos so that there was kiddush at the table and there was company at the table, whatever. We're 4 children, we all live in the metropolitan area. Some of our married kids would come every once in a while, and that's how it went on. Holidays, the same thing. Then my father needed help putting on talis and tefillin, so my mother hired somebody who came in the morning, put on talis and tefillin for him, and left. And then he needed help with other areas of daily living, activities of daily living. We did not hire, my parents did not do planning, financial planning. If you haven't done financial planning, go do it. Okay, they did no financial planning for elder care, and my mother paid out of pocket. So we had these very nice ladies who didn't speak English, who would come in and do whatever my mother told them to do. And that worked for a while. A couple hours here, a couple hours there, overnight, that type of a thing. My father needed to be intubated. He developed aspiration pneumonia because he wasn't being fed properly. He needed to be intubated. He needed to have a feeding tube, and he spent the last 18 months of his life back and forth between a nursing home and a hospital. Most of the 18 months was actually, if I counted up, was probably 16 months in the hospital, total of 2 months in the nursing home. That's how it went. And my mother felt terribly guilty because she always said, I promised Tati that we would never put him in a nursing home. And it took a long time for us to say, but you promised Tati you would try to keep him alive, and this is the way it won't work at home. So I'm standing here as a child who went through 2 different models, or 2.5 different models, trying to maintain a parent outside of the house with support from children, bringing a parent into my home with. Initially, after she broke her hip, we had some support. We had an aide that came in to bathe her, etc., until I learned how to do it. Again, she also didn't do any planning because the government is not getting her money. And so it fell upon us. And then as a child of a parent who tried to maintain a spouse at home and then needed to move into a more facilitated environment, which was really the best choice. And this is something I think that everybody who's a child of an adult parent struggles with. And there really is no right answer. And it really varies. If you would have asked me 2 years and 5 months ago as opposed to 3 years and 5 months ago, the answer would have been very, very different. It's a very fluid situation. So we brought 3 presenters here for you who will be describing not even the various options, but the various considerations that need to be taken into account, as well as the various options that are available. And the only thing I can say to you is that I wish anybody who is in this position to have the clarity and the peace of mind to know that they're really trying their best and making the best possible choice for the situation as it exists, and to be ready and able to shift the focus when that's necessary. So the way the session is going to work is we have three presenters. We have Mr. David Slifkin, who is the Chief Executive Officer of Boulevard Health Management. Prior to that, he was the CEO of Personal Touch Home Care, as well as its insurance subsidy, Integra Managed Long-Term Care. Before that, he held senior management positions in several other health-related organizations. His commitment has and always will be to create an organization that provides the highest level of care to its patients. He is a certified public accountant and has received numerous awards for his contributions to the communities that he has serviced. Immediately, I'm going from middle, and then I'll go to the right, is my dear friend, Rebbetzin Fagi Horowitz of Lawrence, New York, who is the Assistant Director of Communications at Caring Professionals. She's a veteran Jewish communal professional, columnist, and board member of several nonprofits. She started when she was 6. So she's been doing it for a while. She uses her dynamism and networking skills to open doors to opportunity and people of influence in business, nonprofits, and communities. She's a freelance writer, motivational speaker, marketing specialist, and trainer in life skills, as well as an experienced organizational leader and change agent for strategic planning and implementation. She's also the Rebbetzin of Congregation Agudas Achim of Lawrence and a longtime board member of several social service groups where she's rightfully earned a reputation as a community activist, and she holds a master's degree in management. And finally, Dr. Zev Carey, who is, he's here, okay, when you get old like me, you can't see things so well. He's an internist specializing in geriatric and palliative medicine. No, you're not. Sorry, I read the wrong one. He's an attending physician at Mount Sinai. I need a dementia screening fast. Okay, is an attending physician at Mount Sinai, Long Island, specializing in internal medicine, pulmonary medicine, and critical care. He's a member of Hatzalah, a member of Hatzalah of the Rockaways and the Five Towns Medical Board. He's a longtime Far Rockaway resident. His current practice includes homebound patient care, as well as assisted living and nursing home patients. And he's a valuable advisor to Achiezer's medical department. It says throughout the year. I would say throughout the years. He really is a backbone of the Achiezer medical department. So with no further ado, I'm going to ask Dr. Carey to start off and to speak. Then Mr. Slifkin will speak, and then Rebbetzin Horowitz will speak. If you have questions, there are index cards available. Feel free to pass them up to me, and I will be giving the questions as they come up. Okay? With no further ado.
Keep us on schedule?
Yeah, I'm keeping you on schedule.
Okay. Should we dim the lights or we're okay?
I think we're better off just leaving the lights.
Okay. So thank you for that introduction. We have an expression, Al Tashlicheni Lei Zikna, that, has a lot of different interpretations, that Hashem shouldn't sort of throw us or discard us as we get older. And I think one of the mechanisms that Hashem is not throwing us when we get older is by having an organization like Achiezer organize conferences like this to help us, guide us through the very difficult and challenging maze that it is taking care of patients who need our help. Some of the credentials that you heard, I'm a physician of Mount Sinai, I work with Hatzalah, and I'm also the son of parents who also had issues as they were getting older and more needy. So the question I'm going to discuss here, and really in a question form, is going to be, when is the time to ask for more care? I know some of the people in the audience, some of you I don't know, and I know some of the issues that are being discussed here. I know some of the professionals in the audience who take care of a lot of these residents and patients. And one of the questions that comes up often is, how do you know when it's time to start making a change in whatever it is that you're providing, and what are the options available? So I'm going to go through the first part, is 20 questions you should be asking. And this will help guide you to know that something may have changed. Many of them you've probably come across, and some of the questions that come up may be something that you haven't thought of, and sometimes that is a red flag that you need to make some changes. I'm just going to put in a quick disclosure because as PowerPoint I can't keep changing the terms, but I will use the word, instead of loved ones, I'm going to use the word parent in my slides. But that could be, you could be talking about a parent who needs this assistance, it could be a spouse, a child, a relative, a friend, an in-law. I even have one patient who is being cared for by her ex-in-law. So it crosses all social boundaries. The first question is, can your patient navigate the home safely. You have to know, are they able to do their stairs? Often you speak to patients, and I don't go upstairs or I don't go downstairs anymore. Can they get in and out of the bathroom? Are the doorways too narrow to get through with their devices, so they stop going there? Do they have frequent falls? That's a very big, important question. That's something we're actually mandated to ask our questions. And are they using devices, or are devices appropriate for them? Or are they using devices that they found, like just a cane, but maybe it's not the appropriate one? Does your parent have and use the necessary safety equipment? Do they have all the different tools and devices that we have for bathroom assistance to get around the house? Have they had any accidents occurring with appliances, or just something with the stove? Maybe you went to the house and the pot was a little bit burnt. Maybe they have burnt themselves. If your parent smokes, have they had any accidents? Do you see burns in the tablecloths, burns in their bedrooms, in their linens? In the event of a fire, do they know what to do? Will they be safe if they're alone? If they have a device, do they know how to use it? Would they know how to leave the house in case of an emergency? Is your parent or the loved one being bathed regularly, and are they able to maintain their own adequate hygiene? Are they washing their hair adequately? Are they shaving? Often you'll see someone who hasn't shaved in quite a number of days or weeks, and you have to realize that maybe something has changed. Is your parent changing clothes daily? That's something you see them in the same outfit over and over again. That's something that should be a red flag as well. Has your parent become progressively dependent on help with activity of daily living? Now, and this is a term that you will hear over and over again as you go through the different booths, because this is something that drives the whole healthcare system. So these are what ADLs are. ADLs, activities of daily living, are the routine activities that people tend to do every day without needing assistance. Some of the basic ones are the ones here with the acronym of BATted: bathing.
Very appropriate.
Right. Bathing, if it had been taking place somewhere else, I would have a different acronym. Bathing, ambulation, how did they get around? Toiletrying, are they getting there properly? Transferring either from a bed or getting out of the bed, even just standing up from a chair. Are they able to eat alone? Do they need help eating? Is one of the reasons they're not eating because they can't. And are they able to dress themselves? So those are questions that we have to ask, and those are questions that you will be asked when you are applying for assistance. Does your parent allow outside help when they come in to help them? If someone knocks on the door, will they let them in to help? If you send over an aide to help them for the day, if there's someone who's doing the house cleaning, if someone's preparing the meals, are they going to actually even allow them in? Are you able to find qualified help in your neighborhood? Or do you have access to this help? In other words, do you know where to turn to help? Now, if you go up to the fifth floor, you'll see that there are many organizations that can help you. Word of mouth is often a good idea, and you also have to make sure that it's help that you are comfortable using. Have your loved ones become more threatened or suspicious of others? Are they scared when you give them medications to take? Are there certain foods that they don't want to eat? Are they starting to express certain threats that don't really exist? Are they eating properly? Are they getting the right nutrition? Is somebody providing their food? Does the refrigerator have food in it? Does it have fresh food in it? Is your parent taking medications on schedule? Often you'll talk to the patients. If you leave it up to their own devices, you might find out that they decided not to take their medications and they're just sitting on the counter. Have they gotten lost? And unfortunately, this is a red flag that's hard to miss, but sometimes it could be something, they said I was away home from shul and I took the wrong turn, but I finally made my way home. People tend to ignore that, but sometimes that's important. Can they remember their address? Do they know their phone number? Do they know who to contact if they need help finding their way? Another important thing that we have to remember is that as caregivers, we have to worry about the caregivers as well. And are the caregiver duties causing you to miss sleep? If you're getting calls every night that something is going on, and you have to get up and you have to address that, so that may affect you as well. You may miss work. You may be neglecting other household necessities that have to be done. Is the cost of assistance is exceeding your ability to pay for it? And that's obviously a very important issue, and that's where things like insurance and other policies will be a very big assistance. Is your parent willing to participate in the daycare program? A lot of these programs provide a respite for the caregivers and all the other people involved in their care that are very useful as long as they're willing to participate. As a caregiver, is your health being neglected, or are there other family issues that are being neglected? These things shouldn't just be taken and assume that they're going to happen. You have to take hold, and you have to continue your own life and your health in order to be able to provide for others. And the last question I have is, do you have the support that you need? Are you the only family member taking care of their loved one, or do you have the help of siblings or other family members? And that's often an important question too. So these are really 20 questions that will sort of raise the red flag and tell you that yes, things are not where they should be and they have to make changes. So, 2 minutes, no problem. So there are alternate places for patients to reside. And I'll just run through them quickly. We have people in the audience who are experts in some of these, but I'll just run through the basic ones. So one is in-home care. And as Gitti mentioned, sometimes the best or a good situation is to keep the person home and provide them whatever it is that they need. That's probably a whole conference in of itself. Family group homes, and this works very often with things like OHEL, not necessarily for the people in this audience, but sometimes that's a possibility. Assisted living facilities, which provide a certain amount of independence, but it also provides a certain amount of service. Independent senior living communities, where it's sort of a community of seniors, and they provide the basic requirements there, and then there's some that you may have to go out for, and some that they would provide that you can get there. Skilled nursing facilities, which are sort of the highest level. This is the one that people have, grown up thinking that they have to swear off. But when you get to know some of them, and we have the representative from Gerwin here, if you go see some of these skilled nursing facilities, these can provide an amazing amount of care, socially, professionally, medically. So these are something to be considered when the needs are there, and that is the solution. There are some other things I'm just throwing out so you hear the terms. There's something called intentional communities. And that's where basically everything is brought into the home, which is what the patient needs, even though they might be able to, they may have the requirements to go to a higher level place. And then something called continuing care retirement communities, which are not that many of them around, but there are some where you move in when you're more ambulatory and you don't need so much assistance. And it provides for the resident as they go on in time and as their needs increase, they provide increasing services. So that they start out part independent living, part assisted living, and then eventually it could be part-time skilled nursing home, all within the same campus. Just 3 other things I wanted to mention. This is the issues that come out of end-of-life care, and this is something that unfortunately is a very common question. The question is, when do you actually invoke this? But I wanted to just mention 3 terms that people will hear and often are not familiar with them. One of them is comfort care, one is palliative care, and one is hospice care. So comfort care is care that helps a person who is dying or is very ill prevent or relieve their suffering. The goal is to improve their quality of life and respect the wishes of the individual. That's what comfort care means. Palliative care and hospice care are 2 specific types of comfort care. Palliative care is when you have specialized medical care. It's when someone has a serious illness. It's also made to relieve the symptoms and the stress, and it's designed to improve the quality of the life. So here you're trying to make sure that the life goes on in the best possible way. Hospice care is when you're providing care to people in their final phase of life. And there you're focusing more on comfort and quality rather than on curing them. And the goal here is to have as much comfort and to be in a comfortable setting. So the difference between palliative care and hospice care is that comfort care may come with or without a curative component, and the hospice care is designed when you're really not adding the curative component. When you go through the different hospice cares, there are different philosophies among some of them. And some of them allow more intervention, some allow different intervention. When you get to that point, you should make sure you discuss it with someone and get all the information about that. The last thing that I want to mention, which is probably, in my view, one of the most important, is the medical care that the patients are getting. And the medical care spans the gamut, because wherever they are, they still need medical care, and sometimes they need more medical care when they're in a more restrictive environment. And that's routine care, specialty care, whatever type. Psychiatric care, which is a very difficult and challenging specialty to get patients to see. Podiatric care it sounds like it's something simple, but it could be very important. It will give them their whole mobility. Social services, rehabilitation, medical testing, how do they get tested if they can't leave the house, medical procedures, and obviously emergency care. A plan should always be in place. And just since it's an Orthodox, conference, and I think it's very important that you should always have your Rav involved in any major decisions you're making for a loved one. And thank you. We'll take questions at the end.
We're going to take questions at the end. I'm going to take the next card. If you have a question, write it down, and we will take it then. Okay, it's now my pleasure to introduce Mr. David Slifkin, who is going to be talking, I guess, about the continuum of services that are available within an organization.
Okay. Good afternoon. Dr. Carey spoke about when, and I'll use the same term, when a parent may require additional care. I want to speak a little bit about the options that are available and briefly on how those options can be paid for. At Boulevard Health, what we try to do is provide the full spectrum of care. In other words, we care for a patient when they are at home, and then if they need to go someplace else, we also follow that patient, work with him to find another level of care. With respect to home care, there are different levels of home care. And there's a concept in home care and in medicine in general when you're caring for people outside of an institutional setting, and that's to try to provide the least restrictive environment. What that means is to provide the minimum amount of care necessary so your parents can maintain their independence. What we all strive for in life is to try to be as independent as possible. And our mission at Boulevard Health is to meet all of your needs while providing the greatest amount of independence. There's a program, New York State, I should start out by saying, provides a wealth of resources for home care and settings beyond home care. We're unique because there's almost no other state that provides the volume of services and the type of services that New York State does provide. There's a program currently available called CDPAP. You've probably heard the term before. That is consumer-directed care. And what that permits a parent to do who needs care in their home, they can choose a friend, a relative, could be a grandchild, to provide care for them. Now, one of the advantages of this is many of your parents, they don't want strangers in the house. They don't want someone just to come in, interrupt their routine, their daily living. But in this situation, a relative or friend or somebody they know will provide the care. The way the program works, for example, if you're permitted to receive 25 hours of care a week, your parent would designate when that care is provided. Unlike traditional home care, where they schedule the care for you a set number of hours each day, your parent might say, I want someone for those 25 hours on Monday, Wednesday, and Thursday, and that's how the hours would be split up. The care is controlled by your parent, and they have a great deal of options into what they want the caregiver to do. The drawback to this type of care, it is not overseen by a home health agency. It is not overseen by a nursing function. This is for parents, seniors, who can really control, direct what they want done. The next level of care, where the senior or parent is still in the home, is doing work through a home health agency. In this scenario, the home health agency would obtain doctor's orders, work with your doctor, your parent would be seen by a nurse, and the care that your parent receives would be supervised much more closely than it would be in the CDPAP program. And what would you expect from home care? I mean, one thing that a home health aide will do, and it's the greatest concern in keeping people at home, is the safety of your senior or parent. As Dr. Carey mentioned, as you age, you might find steps difficult, mobility difficult, activities of daily living, and that is primarily what a home health aide would do to work with your parent to keep them safe. And one of the biggest causes we find in home health of rehospitalizations are falls. And what the aide would do, if they can't always be prevented, is to be there in case your parent or needed to navigate steps or had difficulty with balance. Even if it was not necessary, the aide would be there as a backup. Combined with this program, and here again, Dr. Carey mentioned it, there's a program called adult daycare. When you're home with an aide, some individuals, they don't want to be home, they don't want to be in their house all day, so there are adult daycare centers where 2 or 3 times a week for 4 hours, a parent will be picked up, taken to a social setting where they'll have meals, entertainment, activities. I've seen centers with modified forms of Zumba, some yoga, and they deal with other people in the same setting, and it'll be a more social environment, so they're not confined to only being in the home. And that, combined with home care, will generally provide the necessary intellectual stimulation to keep your parent involved and motivated about maintaining their health. Now there may come a time that your parent can no longer be at home. And the first thing people may think about are nursing homes. But there are many options in between home care, keeping your parent at home, and going to a nursing home. One of them is known, I'll talk quickly. One of them is known as an assisted living facility. In an assisted living facility, each resident has their own apartment. It is not a nursing home. You have your own apartment with a kitchenette. You eat meals in a restaurant-style dining room. And there are activities all throughout the day, whether they be arts and craft courses. Sometimes there are day trips. But the advantage of something like this is that your parent will be with a group of other seniors involved in many different activities. And, it just so happens, some of you have probably heard of it, our facility in Queens Boulevard is also under the supervision of the OU. We have Minyonum daily. There are Shirim every week, opportunities for learning. So in addition to leading an active life, they can also lead a full Jewish life. Just a minute or two on how all of this can be paid for. There's one thing that, if you're in terms of paying for it, that if you hear nothing else, that there's one point I'd like to make. There are 2 types of Medicaid in New York State. There is full Medicaid and there is community Medicaid. Under community Medicaid, state law and regulations state there is no look-back period. And I don't want to get into all the senior planning issues, but if a senior needs home care, an assisted living facility, adult daycare, that is under community Medicaid. So under community Medicaid, if the assets are disposed of, and that can be done by giving them away through a trust, there are many mechanisms, there are many senior planners upstairs that can tell you how. But the point I want to make is that this care can be available to everyone. There really are no cost restrictions. So with that being said, I just want to thank you, and I'll take questions later.
As Mr. Clifton said, if you have questions like them on the card, feel free to pass them up. It's now my pleasure to introduce Reverend Mrs. Peggy Horowitz.
So staying at home is really a no-brainer for seniors. The AARP, American Association of Retired Persons Survey, found that 90% of seniors want to stay at home as long as possible. And that's really going to be the substance of how to fulfill those wishes. That's going to be the substance of what I'm going to talk about. Obviously, there are some advantages to staying at home. The first being safety and health. We think of facilities where there are a lot of old people together. Old people's immunity systems are somewhat weakened as they age, and the proximity to germs in that many people is something to consider. And of course, there's the independence. Self-sufficiency and freedom are very vital to a person's mental and emotional health. And when we talk about aging in place and having that independence that a senior wants, it's not just living outside of a facility. It means meaningful participation in the community. If your mother was a volunteer, getting out somewhere where she can be a giver, not just a taker, is very important to her welfare. Going to Simcha, shopping in the grocery store, not being given to. And then again, you have people who don't want to have their lives regulated. Now is time for lunch. I want to eat lunch at 1 o'clock. I don't want to be told when and how I'm supposed to have my recreation, which nights are bingo and which nights are movie nights. People want to have their own choices. And of course, there's the comfort. The comfort and familiarity of being in your own environment with your neighbors and in your own space with your own pictures and furniture that you have from 40 years ago. So therefore, 70% of seniors opt to adapt their environments and make modifications. And we'll talk about that a little later. But the idea being that instead of the senior growing out of their home, the home grows with the senior. The home is adapted to the senior's needs, like the doctor said at the beginning, the adaptations. And of course, the social network. Family, neighbors, fellow congregants. You hear older people saying, I don't just want to be around people my own age. They want to engage. They want to laugh with the little one. They want to play a game with the little one. Intergenerational life is really very pivotal. And therefore you have in certain areas, and not just in Lakewood, you have senior communities changing some of the rules to allow younger people in. I don't know if any of you know, just a little interesting fact, I debated whether I should share it or not, but about 30 years ago in London, in Stamford Hill, the Aguda Israel Housing Unit developed a prize-winning, groundbreaking development called Schoenfeld Square, in which there is a total block. I've been to see it. There is a block with condos for young people, assisted living, and then in the same facility with communal areas for outdoor play, and a unit for for people who need more advanced care. So the idea of people being with other generations, giving, paying respect, sharing, engaging with young people is a tremendous, tremendous value. And they've won many, many awards. It's named obviously after Rabbi Dr. Schoenfeld, who saved so many kids in the kinder transport during World War II and resettled them when London was under the Blitz. Then the fourth one is, so we said the social network. People don't want to be only with people their own age. It could be depressing, it could be limiting. And then, of course, the financial aspect. It is much, much cheaper to make adaptations in the home than to pay for extensive residential care in a facility. So what forces seniors into homes that are not their own? What forces seniors out of their homes into assisted living or full-time care facilities? It's usually not the illness itself. It's usually the functional repercussions of the ailment. It's the little things, not necessarily the big ones. Research shows that causes older people to have to move out of their own homes, whether it is not being able to use kitchen utensils anymore, or navigating steps that keep them from maintaining their independence. So it's like the functional consequences of disease. How to get your leg, if you can't get your leg over the tub, you're not going to be able to stay home. Not being able to stand long enough to cook. So housing becomes part of healthcare, and what you can do is a function of where one lives. So the home is really very worthy
of a financial investment because it will help the parents' health. And so researchers believe that small changes in living spaces can make tremendous impact on a person's health. And I want to tell you quickly, because my time is running short, about a groundbreaking research that was done in the Baltimore area by the National Institutes of Health and what the ramifications are for us. This was done with Medicaid patients, so they didn't have a lot to spend. They had about $4,000 to spend on each patient. And what they did was they went into the home and they started the homes where seniors were living, and they asked them, what do you want to be able to do? What makes you scared now? What is giving you anxiety? What are you most concerned about? And they also sent teams in to identify household risks. They sent in a nurse who was able, through her screening, to figure out if a patient was taking 4 medications at once and therefore would be sleepy and disoriented. They also had the nurse look at the safety hazards and risks in the home. They sent in OTs to teach the older people strength building exercises so they could and how to conserve energy so they could stand at the stove a little bit longer. And they invested $1,000 in $1,100 actually into assistive devices and things in the house to make modifications, such as lower cabinets, microwave lower, besides the typical grab bars, or more lighting in the stairwell, an additional banister, and things like that. So they found getting out was an issue for a lot of the people. People felt stuck in their homes, even though they were there, and they were happy being there, but they couldn't take the Accessoride, the Baltimore equivalent of Accessoride, out. So most of these transporters can't take you off and on. So they worked out ways with safety issues. Two key issues of concern for the elderly are bathing properly. Elderly tend to take bird baths. They stand at the sink and do as much as they can where they can reach, and that's not appropriate. I'm done. Cooking's another big one. So what can you learn from this from your own parent? And then I'm finished. Listen to your senior and address his or her insecurities and fears. Don't just watch them and notice when they stumble and when they're forgetting. Pay attention to what they want to be able to do and what they're afraid of. And you have to create that kind of communication that makes that possible. Get a professional assessment of the home environment. Make modifications to the home. 70% of seniors do modifications to their homes. Get tools and aids. Technology is for us. There's a lot of technology to turn off the stove, to make announcements. The Einiklach are coming at 4 o'clock. Did you take your medicine? Flashing, beeping, ringing, calling the telephone. You can connect your Fitbit, your mother's Fitbit, to your own phone, so you know when she's not walking, and then you check in with her. Why isn't she walking around the house at 3 o'clock in the afternoon when that's what she does? She's mobile. There's a lot of technology. This is the era to use the technology to help, and then again, address the physical weaknesses that keep them from doing what they want to do. Thank you.
So much. I think that each one of our speakers really could have used an entire day, not even a session. So far 3 people have passed up questions to me. If anybody else has questions. One is a technical question, which is, can my mother keep her home aides if she goes to a daycare center? Mrs. Slifkin? She has full Medicare plus UHC managed care.
If it was Medicaid, the answer would be yes. With the UHC managed care, you would have to check with the managed care company
Okay.
to see if the aides could be maintained and they offer those services.
Okay. These two are similar, and I'm going to read both of them, and then one person wrote, what is a child supposed to do when the parent is in total denial about his limitations and is providing inadequate care for himself and his wife, and the other siblings are not on board with making a change? Part 2 of that is, what is the advice for parents who are not so elderly, but due to medical and other considerations lack the ability to take care of themselves, even basic hygiene, but they refuse to allow anyone, children or outside aides, to help with the basic hygiene of showers and changing, and the situation has become intolerable. They will not listen even when children address the issue with them directly.
It could be
There's a hot potato sitting right here in my hand. I want to know who to throw it to.
So I'll address the beginning part of it, but creating an environment where you and your parents have trust, respect for their position and their role, but kind of preparing them for the next stage. And that's an ongoing process that should not wait till they're unable to properly take care of themselves. And that's why you need a team and communication with the siblings to be from the start. But when it gets really bad, you may need someone to intervene. And just like geriatric care managers manage a lot of separate tasks, because maintaining a parent in the home or getting them the services they need is a very big
It's a full-time job.
It's a full-time job. It really is. So part of their skills
Right.
are negotiating with all the stakeholders. Hopefully it won't get to that, but if you create an environment earlier on, and European parents are very difficult with
Right.
this.
I wanted to add to that because my parents are survivors. They like to think of themselves as invincible. They once needed major help, and they're never going to want that again. The other part is that sometimes it's a sudden thing. You can have a perfect, like my mother-in-law, perfectly functional, 90, still going to work, and then disabled. So it's a different thing than when there's a progressive disease, and I think both those need to be considered. What about when the child is refusing, Dr. Carey?
So
When the parent, I'm sorry, not the
I
child.
think it's a little bit of challenge at this point to say go back and don't let it happen.
Right.
Because many of us have faced those situations. And I don't think there's one simple answer for everybody. And it happens to be a very common issue. It's often good to have an independent person involved, sort of a mediator, and that they could help take place and speak to all the parties involved. It's sometimes, depending on how you want to influence the individual, you may have to take different tactics. Sometimes you'll do it in a very straightforward way, in a very honest way. You know, you can't drive anymore because it's dangerous, and sometimes you just have to make the keys not available so they can't find the keys. So sometimes you have to use a little bit of, your own sort of mechanisms to do that, and sometimes even subterfuge. But
You become a teenager again.
when you do it, usually you make steps, and you make maybe small steps, maybe large steps, but some of the things are essential because you can't leave them in the unsafe environment.
Okay, any other comments, questions? Yes.
When you've been through several years where you introduce your parents to assisted living, they try out, they don't like it. You have in-home services, which seem more adequate. When you've gone through all the different stages, at what point do you have to learn how to accept your limitations in trying to insert yourself? And how do you behave with that?
You daven a lot. I'll just answer as a child that no matter, you know the famous saying, a mother can take care of 10 children and 20 children can't take care of one mother. It's true. It's true. And that role reversal between being the caregiver to being cared for, every time I bathed my mother-in-law, I cried. Because here was somebody who was vibrant and energetic and she knew I was doing it for her, which made it even harder because she cried too. So it's a very difficult thing, and I think you really need to, I'm going to sound very yeshivish, work on yourself to be able to accept that, and you have to look at the mirror and say, I did the best that I could do. And
I think you also have to realize that most of these situations are not fixed in time and
Right.
they're not static. So whatever you've been through till now, or someone has been through, the same attempts may be
Right.
successful down the road. And again, small increments, things do change, and just in my experience with a lot of us patients and family members like this, over time you usually can introduce some things that will be helpful. It may not be the track that you want to take, but it may be some compromise in between. But it doesn't mean that if it hasn't worked till now that you give up. I think you just need to keep trying the different methods, but it is a very challenging part of caring for it.
okay, one final question.
I think sometimes there's the issue of kibbutz pain, that when you have to take care of a parent, that you're doing something, like you had to bathe.
Right.
a
So
parent,
there
and
definitely are a
that's-
lot of, as Dr.
and to
Carey
see-
said,
And it's not just the bathing, but to see.
there's a lot of halakhic
bathing
issues.
or do
Right.
certain things to a parent, you say, am I allowed to do this?
Right.
Because of kibbutz pain.
So as Dr. Carey said, a rub every step of the way. I had the rabbi on speed dial, literally on speed dial, both in caring for my father and in caring for my mother-in-law. And it's really, it is a very challenging thing. And again, I kind of felt like if I asked the rabbi if this was right or wrong to do, he shared that responsibility. So that goes back to your question about feeling more comfortable with the choices that you made. When it's not, because he still, in my heart of hearts, was always like, did I make this decision for me or for her? And that when you had somebody else to bounce it off of, that gave you more clarity, I think. Okay, there's really a lot more to talk about. Our speakers are listed in the program with their contact information, or you can reach out to Achiezer at info@achiezer.org. I thank you very, very much for joining us, and look forward to a productive day.